guys, this is Tyler from Southern California EMS Training Institute. Today we're going to be showing you guys a medical assessment dealing with a diabetic patient with acute altered mental status and hypoglycemia. We're going to go ahead and run through that. And before we go into scene, we'll make sure that we have our scene safety. So our BSI ready to go, personnel safety. There's no environmental hazards that we are aware of at this time. We are getting called out for one patient found down, confused by fellow coworkers. And that's kind of all the information we have so far. No additional resources have been started, but we're going to go ahead and get ALS and fire department on their way since it is a confused patient. This is load and go. And then no need for extrication unless potentially this patient hit his head or something like that, which maybe we'll bring that equipment with us and determine on scene. All right, so we're walking in on scene, get my general impression. Looks to be like a 20, 30-year-old male, appears to be slumped over in the chair. Get called out for a patient who's found confused or altered today, and coworkers let us know that he is diabetic upon arrival. Hello, sir.
Oh, ow.
Sir, how you doing?
What's going on?
Your coworkers just gave us a call, said you weren't feeling too well.
Oh.
Has this ever happened before?
I don't know.
All right, sir, what's your name?
Taylor?
Taylor, can you tell me where you're at?
I think I'm at work.
Okay. All right, do you know what year it is?
No.
No?
No.
Okay. And do you know what's going on? Do you know why we got called out today?
No, who are you?
Hi, my name's Tyler. I'm an EMT. I'm going to be helping you out today, okay? All right, well, his airway seems to be open, clear, maintainable, because he is talking to me. His breathing looks to be about 12 times a minute. Appears to be full and effective. I'm going to go ahead and put a pulse oximeter on your finger, Taylor. All right, I'm going to check his skin signs. Skins feel pale, cool, and clammy. His pulse rate feels about 80 beats per minute. Seems to be strong and regular, and I don't see any signs of major bleeding. My patient right now is ANO times 2. He was only alert to painful stimuli, so he is going to be a load and go patient. At this time, I get my pulse oximeter reading back. It says 99% on room air, so I'm going to go ahead and hold off on any oxygen. But we're probably going to get him loaded up and get him going into the ambulance right now. While we're doing that, I'm going to have my partner grab me a full set of vitals. That's including pulse, respirations, blood pressure, eyes, lung sounds, level of consciousness, skins, and we already got our SpO2 going right now. While he's doing that, I'm going to go ahead and start asking some OPQRST and sample questions and go from there. Taylor, is anything bothering you currently?
No.
No? Not having any pain, not feeling weak or lethargic, no headaches, nothing like that?
Feel weird.
You just feel weird? Okay. Do you know when this started, approximately?
What started?
Just not feeling right? Just kind of feeling weird?
Just remember working and just I think you woke me up. I don't know what's going on.
Okay. All right, so you don't know how long maybe you were working for?
No idea.
Okay. All right, sounds good. Taylor, you been drinking any alcohol today?
No.
No? Any history of seizures that you're aware of?
No.
No, doesn't appear to be incontinent. Can you open your mouth for me really quick? Doesn't look like he's got any oral trauma. Are you diabetic?
Yeah.
Yeah? Okay, yeah, your coworkers mentioned that you were diabetic. When was the last time you had anything to eat or drink?
I skipped breakfast.
Okay. All
I
right.
haven't ate anything today.
Okay. As my partners are grabbing a full set of vitals, I'm going to make sure they grab a blood sugar for me. You not been feeling any short of breath or anything like that? You don't take any medications?
No.
No? Okay. No history of dialysis, anything like that?
What's dialysis?
Alright, sounds good. You haven't hit your head at all recently, correct?
No.
No? Alright, don't see any signs of trauma. Alright, skins don't appear to be warm, like he's got any type of infection anywhere. Sounds like it doesn't have any psych history. I'm going to check for shock with our blood pressure and our vital signs. I'm also going to check for a stroke scale really quick. Hey Taylor, a couple things. Can you just give me a big smile? Excellent. Eric, can you put your tongue out? Good. Can you just say, repeat after me? You can't teach an old dog new tricks.
Repeat after me. You can't teach an old dog new tricks.
All right, you're clever. All right, we're going to go ahead. I'm going to have you hold your palms up just like this. Go ahead and close your eyes for me. Good, go ahead and put him down. Doesn't appear like he's got any arm drift. We're going to get that blood sugar back. My partner's a little slow, so we're going to go ahead and get that blood sugar done real quick. Taylor, I'm going to go ahead and just check your blood sugar. All right, it's going to be a quick poke in the finger.
Am I in trouble?
No, you're not in trouble. We're going to take good care of you, okay? All right, let me see your finger really quick. All right, quick poke. 1, 2, 3. All right, go ahead and just hold that for me. Blood sugar came back at 47, so we're going to go ahead and we're going to give our patient some oral glucose to go ahead and treat our hypoglycemia, and we're going to go from there. As I'm doing this, I'm going to go ahead and continue to go through my sample history. Taylor, do you have any allergies to any medications?
I don't think so.
Do you take any medications at home?
I don't think so.
No? Alright. Potentially just take your, control your diabetes with your diet?
Should.
Okay. Any medical history that I should be aware of?
No.
No? Last thing you had to eat or drink, was it last night? Is that correct?
Yeah.
Yeah? Okay.
I think. Didn't have anything today.
Okay. And then you were just working before all this started, correct?
Yeah, am I in trouble?
No, you're not in trouble. No, we're going to take good care of you, alright? Since he's feeling a little bit confused right now, I might go ahead and ask some of the coworkers exactly what's going on, just to get a little bit more accurate history. I'm going to go ahead and I'm going to call medical direction to administer my oral glucose. So I'm going to go ahead and get on the radio and go ahead and do that right now. I've deemed that it's necessary for me to call medical direction in order to give my patient oral glucose. It is an online order, so I'm going to go ahead and call medical direction now. Medical direction, over. Can you hear me?
This is medical direction. Go ahead.
Hey, medical direction. This is unit 123. We responded today for a 25, 30-year-old male patient found confused by coworkers. Patient was found down approximately about 10 minutes ago, unknown exactly how long he's been out for. He was alert to painful stimuli. He's ANO times 2 after we've kind of woken him up a little bit. We put him at a GCS of 12. Patient's airway seems to be open, clear, maintainable. He seems to be breathing okay. He was SpO2 99% on room air. We got a full set of vitals on our patient. Found out his blood sugar was 47. So we'd like to go ahead and give our patient oral glucose. He does have a history of diabetes. It is controlled only by his diet, he says, and he hasn't checked up in a while. But other than that, we'd like to go ahead and administer 1 tube of oral glucose. What do you guys think?
Copy. We really read you loud and clear. Go ahead and start off with 1 tube of oral glucose, and then contact me, see how he's doing, and then what's your guys' ETA to the hospital?
Our closest hospital is about 10 minutes away, and so when we get started, probably about 10 minutes, and we'll go ahead and copy that 1 tube of oral glucose.
Copy. Anything else for me?
Negative. Thank you guys so much. We'll see you inside. After I've called medical direction, I'm going to go ahead and go rice and dice my medication. All right, I'm going to give it to my patient here, which is Taylor. It's going to be oral glucose. I'm going to be giving it orally. I'm going to give the whole tube. I'll make sure I document, and it is 10:07 right now, so I got all that ready to go. Again, the drug is oral glucose. It is going to be the whole tube. Integrity looks to be good. Clarity looks to be, can't see it. And then the expiration, it's actually not expired, so we're good to go. The contraindications for this medication is documented blood sugar over 70, which I don't have. My blood sugar was 47 upon checking it, and if he's able to swallow, which he appears to be able to control his own airway and follow commands. So we're going to go ahead and have him just ingest this oral glucose. Taylor, I'm just going to take this off. You just go ahead and suck down that whole tube for me. All right, as he's doing that, hopefully we've gotten the stretcher ready. We'll get ready to go ahead and move our patient. And in about 5 minutes, we're going to reassess our patient, and we're going to call the hospital to let them know what's going on. Taylor, how you doing?
Feeling a little bit better.
Feeling a little bit better? Oh, you sound a lot better.
What's going on?
Well, your coworkers called us because they found you just at your desk and you were kind of slumped over.
Is my blood sugar low?
Yeah, has that happened before?
Yeah.
Yeah, alright.
I forgot to eat this morning.
Yeah. Taylor, really quick, can you tell me where we're at?
Yeah, we're at work.
Okay. Do you know what year it is?
Yeah, it's 2020.
Okay. And you know why we got called out?
Well, I mean, my blood sugar was low. Was I out of it or something?
Yeah, you were. Since you haven't gotten anything to eat today, it's really important we get you some food, okay?
All right.
All right.
Yeah, I'm hungry.
Okay. Any medical history that I need to be aware of?
No, just diabetes.
Okay. All right. Any allergies to any medicines?
No.
No. And do you take any medicines for your diabetes? Or is it just controlled by your diet?
I just diet.
Okay.
If I don't eat it, then
Okay.
sometimes it goes high or low.
Okay. All right.
What's my blood sugar now?
You know what? We'll recheck it, and then we'll get you down to the hospital so the hospital can take care of you and continue to assess.
All
Sound
right.
good?
Yeah.
Are you okay getting transported down to the hospital today?
Yeah, I still kind of feel weird a little bit.
Yeah. It's going to take a couple minutes to come around, so. All right. Very good. Let's get you down to the hospital.
All right.